Welcome to another episode of the Longevity Blueprint podcast. Today I have Dr. Veronique Desaulniers, which I will be calling Dr. V. She is the founder of Breast Cancer Conqueror, the 7 Essential System, and co-founder of My Breast Friend, which you're going to get to hear about today. Her signature process has empowered thousands of women in over 48 countries around the world. Dr. V has personally conquered breast cancer twice, which gives her an empathetic perspective to understand other women facing a healing journey. Dr. V has been in the wellness industry for over 40 years, beginning with her chiropractic degree in 1979. Dr. V has also pursued extensive studies in various fields of energy medicine. Her specialty is chiropractic, bioenergetics, meridian stress analyses, homeopathy, and digital thermography. This gives Dr. V a unique approach to health and wellness. She is an Amazon #1 best-selling author of Heal Breast Cancer Naturally, 7 Essential Steps to Beat Breast Cancer, in 5 countries and in 10 different categories, including oncology nursing, breast cancer, cancer oncology, alternative medicine, chemotherapy, health, fitness and dieting, women's health, and reproductive medicine. So welcome to the show, Dr. V.
Thanks for having me, Dr. Stephanie. So proud, so happy to be here.
I'm happy that we can post this episode in October, Breast Cancer Awareness Month. So we're going to talk about breast cancer today. So can you tell me your personal journey and why you're so passionate about sharing your message of hope with women around the globe?
Yeah, so I would say my journey started back in 1983. I was in practice for 3 years, and my father was diagnosed with pancreatic cancer, and it was really my first initiation into the cancer world with conventional medicine. And they gave him no hope, sent him home to die, and he was gone within 6 weeks. So that really lit a fire in me, because I realized, as a chiropractor, as a physician, I knew that the body had an amazing capacity to heal. Mm-hmm. And so I, dove into the research and called some cancer clinics, which were few and far between back then, and realized that there were things that could be done to support somebody who's, dealing with cancer, be it breast cancer or pancreatic cancer. So I started applying these principles in my practice and saw some really amazing results with my patients. Now, fast forward about 23 years into my practice, I'm in the shower and I'm getting ready to go to work, and I'm doing a breast exam, and bam, felt that lump that really changed the course of my life professionally and personally forever. So that led me down the journey. What was I missing? Here I was, Dr. B, teaching everybody about health and wellness principles. I thought I was doing everything right. I ate organic before organic was in style. I had my children at home, I had home births, breastfed, exercise, chiropractic, nutrition, you name it, I was doing it. But obviously there were some things that I needed to learn. And so that started me on, my first healing journey. And when I was in the journey, there was a lot of confusion and frustration and overwhelm, just like anybody else, right? Anybody who's dealing with that. And I'm a very organized, systematic person. So I said, there's got to be an easier way to do this. And that's when I had that light bulb moment. I'll create a system so that it's easier. And that's where the 7 Essential comes in.
Wonderful. Let's jump into both of those. So, but I want to talk about the 7 Essentials, and I want to talk about a game-changing training kit that you call your Breast Friend.
Okay.
So let's talk about both of those in whatever order you'd like.
Okay, let's start off with My Breast Friend. Okay. Because I think that's so key, especially for the month that we're in. So we know there's a big push in the pink month for early breast detection, right? Breast cancer detection. Well, mammography may be one way. However, there's a lot of other things that we can do outside of conventional medicine, thermography, and of course, breast self-exam. And women have never been trained. You ask women, do you do a breast exam? And most of them say, no, I'm scared. I don't know what I'm feeling. What if I find something? And so I wanted to kind of bust through that myth. And that's when I had the opportunity to bring My Breast Friend to market. So this is a silicone breast model that has been used for over 30 years. Now this was created with the help of the National Cancer Institute, the National Science Foundation, and the University of Florida, Gainesville, Florida. And they got together and they said, let's create a very lifelike breast model that has tumors in it, and these are replicas of live tumors that were taken out of women's breasts, and let's put them in different positions so doctors and nurses can learn how to do a proper breast exam. Thousands of doctors have been trained on this. 30 years later, the manufacturer and the originator of this asked me to take this to the general market so women could now have access to this training system. And I want to point something out to your audience. So, and this is really shocking. It was for me. So the average size lump that is found by a woman who's not trained in a breast exam is the size of a ping pong ball.
Wow.
When you get training, you can get it down to the size of a pea. And if it's less than a centimeter and it hasn't spread, life expectancy over 15 years is 88%. So your chances of survival are huge. And so this training system teaches you where to feel, how to feel, and what to feel for. Because until you know what a lump feels like, you really don't know what you're looking for, because your breasts are very nodular and dense and fibrocystic, and you're just wondering, what is that? What is that? This teaches you that difference. So my breast friend is really a game changer. I really feel it's going to save a lot of lives. And you know, we've received emails from women all over the world, and one from Australia not too long ago said that she used the system, she found a lump, she went to the doctor, he couldn't find it.
Wow.
She had to show him where it was. So it's pretty exciting to be able to teach women about, you know, being empowered. You know, don't rely on a machine or somebody else's fingers, because even if you get checked once a year and you do your mammogram once a year, there's still 364 days of the year where your breast tissue can change, right? So be proactive with it.
That's good. That's good. So your mission is to inspire women to be proactive and to help make informed decisions. And you have this signature process, which you created, called the 7 Essentials System. So can we go through the system? There are 7 different steps. So let's just start with number 1, which I believe is let food be your medicine.
Yes, yes. And I'm sure your audience is very well aware that food is foundational. Is there a cookie cutter diet that you know, is the diet, anti-cancer diet? I don't believe so. I think you really have to tailor it to your particular needs, physical needs, genetic needs. But overall, you know, 80% raw, plant-based, lots of greens, lots of cruciferous, soaked nuts and seeds, you know, that sort of thing, lots of greens. Juicing, depending on your blood sugar, or blending, you know, and there's a great test called the nutrition genome test, which looks at your DNA and looks specifically at the weaknesses that you have and how to best support them with food. So if you're confused about your food, that's a great simple test to take, and it'll really help guide you.
Wonderful. Yeah, I absolutely believe food needs to be our medicine. My doctor was on estrogen metabolism, actually. So speaking to the cruciferous vegetables, DIM is a supplement that I recommend to many of my patients. So DIM is an extract of cruciferous vegetables. I tell patients it's kind of like eating 8 or 9 pounds of them a day without the gas. But
That's right.
DIM can positively influence estrogen metabolism for the better. And we may circle back around to estrogen metabolism at the end. So I'll leave that there. But I usually tell patients, purchase every week some cruciferous vegetable, whether that is broccoli, cauliflower, bok choy, kohlrabi. Purchase something and go through that. I mean, ideally, you'd be eating them every day, but at least every week, purchase some food in that family and go through it for you and your family for the week.
Absolutely.
So number 2, and you can correct me if I'm wrong here, but number 2, I believe, is to reduce your toxin exposure.
Yes, yes. So we can't live in a bubble. We know we live in a toxic world, right? Even if we try to eat organic, we're still getting glyphosate spray from the farm next door, unfortunately. So there's lots of categories of toxins. You can look at it from an environmental point of view, and then you look at it from, you know, bringing it into your home. And that's really key, because there are hundreds of chemicals that can, you know, stimulate breast cancer if you're not using the right products in your home. So your cleaning products, even like scented candles, you know, things like that, just the little things inside your home. EMFs are a huge, huge problem. We don't feel them, we don't see them, we don't taste them, but they're around us 24/7, and especially with 5G rolling out now. EMFs are huge problems. And fortunately, there's great technology available now that can help reduce our exposure and really protect us from that. And then even if we try to eat clean and be clean, there's still the detoxification process. Think of it like a little drip, drip, drip. No matter how clean we try to be, there's still some toxicity we're exposed to. So look at learning to detoxify properly with, hyperthermia, different kinds of saunas, biomat, sweating, lymphatic massage, coffee enemas. I'm a firm believer in coffee enemas because that helps stimulate that glutathione production. Skin brushing, all those things. So important to really detoxify. And there's so many herbs and supplements that can help support that detoxification process also.
Absolutely. Staying on this topic for a minute, I'm hopefully this week getting installed into my home, which I've mentioned on a few of my episodes here, this Power Perfect box, which will essentially, at the end of the night, I can just flip a switch and I can then shut off the power to many of the circuits in my home to heavily reduce the EMFs to the home. So I'm really excited to implement that.
Power Perfect box.
Yes. I have a family member. I can send you more information on that.
Yeah,
Happy to show if you'd like. I plan to do more videos on that once it's installed and just to be able to share that with my patients. But that I think will tremendously help reduce the EMFs because they are invisible and we don't always see them as being dangerous. And we have this, just like how there are layers of toxins on our foods, we have layers of these invisible EMF toxins, right? I have a wireless mouse. I'm in front of a computer. I have an Apple Watch, but it's not on, but if it was, that that would be, I'd be exposed to my cell phone. So there we have these layers of toxins that we're not always aware of could be causing problems. I love that you said sweat because sweating is so important, and regardless of the toxin, sweating can help you eliminate it. So whether you are suffering with high levels of glyphosate, as you mentioned, or mold toxins, or we can even accumulate herbicides and pesticides in our body. Heavy metals, the chemicals that are found in personal care products, right? Sweating can help us eliminate them. We want to remove our exposure, not continue to add to our burden, but sweating can help us absolutely remove them. If we stay on the topic of personal care products, what are some chemicals that are high on your list for avoiding? I'm assuming like fragrances, since you mentioned the scented candles.
Absolutely. And anything that contains any type of heavy metal, so aluminum, antiperspirants, because we know that specific heavy metals are known as metalloestrogens or, chemical estrogens. They'll mimic and stimulate estrogen in the body. For breast cancer specifically, be very careful with dry cleaning fluids, plastics, herbicides, pesticides, all those things are what we call xenoestrogens or chemical estrogens.
Sure. Can I ask you a personal question?
Of course.
So with your breast cancer that you found, was that in more of the axilla area? Which area was that found? And was that a more hard to maybe palpate area of the breast or an easier to find?
Yeah, it was actually, I always get confused on the clock. But it was out here, upper outer left.
Which is where the majority of breast cancers happen, right? Yep.
And I had also via ultrasound, I had 4 swollen lymph nodes, and of course conventional medicine would say take them out, but I just kept going through the process, and now they're all gone except for one. It became calcified. It's a granuloma now. So we need our lymph nodes.
We do. So let's move on to, since we have 7 steps to get through here, number 3, which is balance your energy. Tell me more about that step.
Okay, so we are energetic beings, right? We are 1/10000000th physical matter, according to a Nobel Prize laureate. So what does that mean? That means that we have to learn to balance our energy, not just our physical body. So everything from chiropractic care, acupuncture, exercise, sleep. Sleep is so critical. If we're not getting a restorative 7 to 8 hours of sleep, your body is just not going to heal properly. And then key for number 3 is balancing your hormones. Conventional medicine has created so much fear about women and their hormones, right? You have an ER/PR positive cancer, so you got to stop those hormones because that's what's driving the cancer. Well, if our hormones drove cancer, then every 20-year-old on the planet would be laden with cancer, right? So it's not our hormones, it's our, first of all, it's our overexposure to all the chemical hormones in the environment. And secondly, it's our ability to metabolize or methylate our hormones properly. If we can't break them down, if you have a genetic weakness that prevents you from breaking down that estrogen properly, or if your liver is too toxic and it's not breaking it down properly, or if you're constipated and the hormones are recirculated, then yes, that can certainly be a causative problem. But, you know, reduce your exposure and learn, you know, work with somebody who's an expert in balancing your hormones naturally, so you don't have to, you know, worry about this, you know, all these medications that are designed to suppress your hormones. You know, we need our hormones for our brain health, our heart health, our bone health. I mean, everything. Shut down the hormones and you feel horrible.
Totally agreed. In chapter 6 of my book, Your Longevity Blueprint, I literally say what you just said. If hormones cause cancer, we'd have a bunch of 20-year-olds walking around with cancer, and a bunch of 90-year-olds very cancer-free, right? The women with the low hormone levels. And that's not the case. So the 20-year-olds who have higher hormone levels are more protected. Their immune system is stronger. So they're less likely to get cancer and to get sick. And I tell my patients, hormones aren't dangerous. It's the means by which our body detoxifies or eliminates, metabolizes those. And that comes down to the liver, to methylation, like you're saying. And there are genetic predispositions. And that's something that functional medicine providers can look into. They can look at your genetics to see if you're predisposed to not clearing them out appropriately. And if you are, we can't change your genetics, but we can change your diet. We can recommend supplements to more assist the body eliminate those and hopefully prevent breast cancer from happening. So I am totally on board, agree with everything you said there. What about number 4, which is healing emotional wounds?
That's a big one. You know, if I were to restart the 7 essentials, I think I would put that as number 1. You know, it's the emotional, the psycho-neuro-immunological aspect of our body's ability to heal. And, you know, it's not tangible like taking supplements or doing enemas, right? It's a matter of really looking at your life, looking at your past, looking at your childhood, looking at whoops.
Microphone fell.
Dropped the microphone. Things happen, right? And so, you know, when I think back about my healing journey and even, you know, the second round that I went through, you know, I come from an alcoholic background and I was sexually abused from the age of 3 to 5. And, you know, I had the repressed memories that popped into my head after lots of therapy in my late 40s. So there's really such a link there. And when you look at it from, you know, the Chinese meridian point of view, you know, your right breast is the male side, left breast is the female side. So if you have father or male issues or mother or mothering issues, that'll give you an indication. And it's about learning to buy out time for yourself, to really take the time to calm your nerve system. Because if you stay in the mode of fight or flight and you have the pedal to the metal, you know, your sympathetic nerve system is just constantly, you know, going, and healing cannot occur if you feel like you're being chased by a saber-toothed tiger, right? Got to bring it down, calm it down. And, you know, that takes time and it takes practice to meditate and to, you know, learn how to do EFT tapping or use the HeartMath app or, you know, just buying out time for yourself, journaling, meditating, praying, all these things that are so important in the healing process. And I think the big picture overall of that is visualizing your outcome. You know, what do you want the outcome to be? You know, see yourself and feel yourself on the other side of the journey where you're vibrantly healthy again and the tumor load is gone and, you know, your blood labs are normal and your scans are clear and you're celebrating with your family. I mean, that's, you know, that's the picture that you want to envision, not the what ifs and, you know, the fear-based pictures that often come up.
Very interesting. Actually, today earlier, I interviewed Dr. Keisha Ewers. I don't know if you know her.
Oh, yeah,
but,
we're good friends.
Yeah, I imagine. Similar stories, actually, also. We both had history of abuse and breast cancer, and her episode will also be shared in October. But I love that you're both bringing to light the importance of looking at past traumas, because they do play a role, and we do need to heal those emotional wounds. And it's an ongoing journey, but it is something that I think is often neglected. So I love that we're shedding light on that today, because that is very important. And I love that you said to visualize yourself without the tumor, right? Oh my gosh, there's so much power in that. Visualize your body whole and healed. I think if we should be spending more time on that, but I think we spend so much time dealing with the illness and not as much time on visualizing our body healed. I think there's so much power in that. So I love number 4. So number 5 is to embrace your biologic dentistry. Is that what that says? Yeah.
Biological dentistry.
So tell me more about that. Yeah.
So what's in your mouth is going to affect your whole body, right? So if we just start with basic things like amalgams and fillings and crowns, I mean, we know that a filling is 50% mercury, and mercury is labeled and classified as a metalloestrogen. It mimics and stimulates estrogen in the body. So obviously you want to remove those. You want and work with a biological dentist who's certified and he's following the proper procedure, because if you don't do it right, you can end up being very sick, very toxic from all the mercury dumping. And then we can look at crowns, same thing. You know, if they have a metal base, that's going to affect, you know, the tooth. Root canals. Root canals are basically like having a dead organ in your body, right? No matter how aseptic you try to make it, there's always a pocket of anaerobic bacteria at the root that's going to drip toxins and suppress your immunity. So that's from a chemical point of view. And then of course we have to include the microbiome of your mouth, right? If you have lots of pathogenic bacteria, gingivitis, gum disease, that's going to also have some effect. From an energetic point of view, our teeth are connected to all our organs through the acupuncture meridian system. So if we have a root canal or a big filling on a breast meridian, that can certainly affect that energy flow to that organ. So lots to learn there. And biological dentistry is often a big one for people, A, because of the expanse, but B, you know, who likes to sit in a dentist chair and, you know, have a lot of work done, but it's so worth it. I mean, I've seen so many women turn around after they agree, okay, I'm going to dive in and do it all. Because you can't just do, you know, 6 out of the 7. You've got to do all the 7.
Remove all the metal. Yeah, I see a biologic dentist too, and I had the metal removed from my mouth. I think that's so important. I have to ask out of curiosity, because I don't know. So which teeth are in that breast meridian that you mentioned?
Okay, so if you start from the center on the bottom and you count 1, 2, 3, 4, 5.
Okay.
So on the bottom, these 2, and then on the top, it's 4, 5, 6, 7.
Okay.
You can, if you just, you know, look online for dental meridian charts, you'll see there's so many charts out there.
Okay.
You can see how which organs are connected to which teeth.
Thank you. Did you have any that were correlated with your breast cancer? I'm asking another personal question here.
Yeah, no, that's fine. Actually, so in the early 90s, I had 16 teeth redone. Obviously, my parents didn't believe in dentists, and I had 16 amalgams in my mouth.
Wow.
Fortunately, I found a biological dentist who was trained by Dr. Hal Huggins, who was the pioneer who, you know, started all this back in the 80s. And so I had all that redone. But one thing that I did not know about was cavitation. So cavitation, right, is an infection in a bone after you've had an extraction. And I did have a cavitation on my bottom left tooth, which was the breast meridian, incidentally. Now, second time around, I had to dig a little bit deeper. And it turns out that I had root resorption. It's an autoimmune disease that affected one of the teeth that sat on the breast meridian. It was a dead tooth, but I didn't know it. It was empty and hollow inside. Very rare thing apparently, but so I had to have that tooth pulled, and then had a beam scan done, 3D beam scan, to see if there were any more cavitations, and there were from other extractions. So had those taken care of.
I'm taking notes. Okay. Thank you. Thank you for sharing that. All right. Number 6 is repairing with therapeutic plants. This will be interesting.
Yeah. Okay. So therapeutic plants and herbs and vitamins. This is, you know, the #1 question that we get. What do I take to boost my immunity and kill this cancer, right?
Yeah.
So we could spend a whole day on it, but just, basic stuff is, making sure that your iodine levels are proper. Don't just guess and take iodine randomly. You want to make
Sure.
sure that your iodine levels are optimal. Vitamin D, so simple, so critical. If your vitamin D levels are optimal, it'll reduce your breast cancer risk by 83%. Just that, and it's going to increase your survival rate. So
Yep.
from a therapeutic range, we want it to be between 80 and 100. And that really gets your, your macrophages nice and happy. So, and then we look at, different kinds of supplements. So things like, artemisinin or wormwood, berberine, basic minerals like zinc and selenium, very, very important, magnesium. Then there's different products, everything from B17, amygdalin, or there's poly-MVA, there's Orasal, salicinium. So there's a list of various products out there that are specifically designed to target cancer cells and boost your immune system. And then, you can look at the various therapies like high-dose vitamin C IVs and EGCG. So, in matcha green tea, for example, there's over 100 times more of the EGCG, which is a cancer-killing, nutrient, than regular green tea. You can get an IV of that. Mistletoe is another one. So there's just a plethora of things out there, and it can be overwhelming, which, what I do in my book, so Heal Breast Cancer Naturally. And so in the book, I basically outline everything alphabetically, but it gives you an idea. And I really encourage women to, work with a coach or work with a functional doctor that can walk you through the process so that you're not just guessing, and make sure you get tested, look at your numbers, look at how your scans are improving, make sure that you check all the bases to see that you're moving in the right direction.
I totally agree. I run comprehensive nutritional analyses on my patients. So we can look at not just their vitamin D levels, but their vitamin C. We can look at their glutathione levels. We can look at their oxidative stress in general, look at their toxin markers, but really also see if they need B vitamins to help with methylation. So running that really helps us personalize our treatment for patients. And IV vitamin C is something that we offer our patients also, which is wonderful immune support. So we think alike there as well. So number 7 in your essential system is to very early detect cancers or abnormal changes with thermography and special blood tests and cutting edge technology. So I'm glad we're talking about this because I get this question a lot, mammogram versus thermography. So let's dive into your opinion on this. Okay,
so first of all, we want to make sure, as we mentioned, keep a pulse on our health. And the best thing that you can do is just, make sure that you cover all the bases on specific things. So if we talk about mammograms, and I'm not telling anyone not to have a mammogram, but you have to, look at the data and look at the effects. So we know that radiation causes cancer. Compression can cause a small tumor to rupture and spread malignant cells. A 25-year Canadian study done on 90,000 women showed that mammograms did not reduce breast cancer mortality rate, not even by 1%. And it was just as effective as, as an exam, finding a lump that way. And we know that it takes 6 to 8 years for a lump to be seen on a mammogram. So what if you had the opportunity to see something when it was only, the size of a pinhead or just starting to develop? And that's where thermography comes in. Now, thermography, like any other test, is not 100%, right? Which is why I always encourage our clients, don't rely on just one test. If you do a mammogram, get some ultrasound to back it up. Or if you do a mammogram, do a thermogram, or vice versa. Do more than one thing. Mm-hmm. So thermography looks at the infrared heat that's being emitted from the body. And where there's inflammation, where there's increased blood flow, as if there's a tumor developing, not 100% of the time, and about 97% of the time, you'll see that vascularity and that heat. It's going to show up as red hot. It just reads the infrared heat coming off your body. So if there's inflammation, it's going to show up red hot. If it's cool and normal, then it's going to be blue-green. So it's a great tool to use. There's no compression, no radiation. It's just a good overall scan, not just for the breast tissue, but you can look at your carotid arteries, your thyroid, your sinuses, TMJ, gallbladder, liver, varicosities in your legs. I mean, there's all kinds of things that you can do with thermography. And then if we think about what we call liquid biopsies or, blood tests outside of the, conventional medicine. So there's a company called RGCC, and I forget what it stands for, but it's also known as the grease test.
Mm-hmm.
And they, they collect the blood sample, they filter the blood, they look at circulating tumor cells, breast cancer stem cells, and then they'll grow those cells in petri dishes and then test 50 different chemotherapies, 50 different natural substances to see which substances affect the cancer cells more rapidly. So you have an idea of what's more effective. So it takes the guesswork out of your protocol. There's also simple tests that you can do. Look at inflammatory markers like C-reactive protein, LDH, ESR. Those are simple tests, but if there's lots of inflammation in the body, then maybe you're still, actively cancering or producing cancer. Hormones that cancer cells produce, always get confused, HGH, or no, what's the pregnancy hormone?
HCG.
HCG, there you go. I was thinking about HGH earlier with the cream. So HCG, so if you're not pregnant, obviously, and you've got high HCG in your urine and your blood, chances are you may be producing some cancer cells. So,
very good recommendations. I advocate for breast thermography, absolutely, but I do tell patients that thermography doesn't replace mammography. They're just different ways, right, of looking for lesions. And I do think ultrasound is wonderful. The new automated whole breast ultrasound is what many of my patients are wanting and opting for because the radiation's not there. Yet if we find something abnormal on thermography scan, then they can follow up with that by getting an ultrasound.
Yeah.
So we already talked a little bit about if hormones cause cancer, and I think we both are in agreement that hormones are not the variable. Hormones don't cause cancer. I will say that hormones could feed an existing cancer. Right.
Yes.
So if I had a patient who had an estrogen receptor positive breast cancer, I'm not going to be, giving her high doses of estrogen. That's not a good idea logically. Right. But I think we're both in agreement on that. I do want to talk about some myths. So we've gone through the essential points of your system, which I think are wonderful, but I also want to get into a few myths also. So myth number one, I'll ask your opinion on, is that plant estrogens are dangerous and should be avoided. What's your take on that?
Well, we'll hear that from traditional doctors, right? If you're a cancer patient, don't do plant estrogens. So, flax or soy or, foods like that because they're dangerous and they're going to fuel the cancer. Well, plant estrogens actually have a protective effect. They protect the receptor sites. They help to, especially flax, helps to metabolize and break down the aggressive estrogens and move them out of the body.
Yeah.
There was an interesting study done at the University of Toronto years ago where they fed women a muffin, which it probably was made with white flour and sugar, but nonetheless, it had 5 teaspoons of ground flaxseed in it. They measured their markers before and after they were getting ready for surgery. And they found that 1 muffin per day for 30 days decreased their breast cancer markers, from anywhere from 35% to 73%, just in a month of flaxseed, without any other changes in their lifestyle. So, flax can be very, very powerful. You can sprinkle it on your salads, put it in your smoothies. Make sure you grind it yourself at home. Don't buy the pre-ground stuff. It's going to be oxidized. And, just make it a great part of your diet.
That's a really good point. So everyone who's listening, you have to grind it yourself. So just FYI, that's a really good point that not many people do mention. So thank you for pointing that out.
And
I'm wondering in the fridge. Yeah.
In the fridge.
Thank you. Here's another myth. I think it's a myth now. That the BRCA gene is a breast cancer death sentence. So many women find out they have the gene and they get depressed and scared and anxious. What is your take on having the gene? And do you have the gene?
I don't have the gene. But I've worked with several women who have the gene and have done very well in healing cancer, breast cancer. Um, so first of all, we now know, I mean, it's common knowledge with epigenetics, nutrigenomics, that our genes and our DNA are not our destiny, right? We have a huge impact on how those genes are expressed. So you may have a BRCA gene mutation, but is it, what are you going to do to express that gene? So if you watch your lifestyle and you stay away from sugar and manage your stress and, follow the basics of 7 essentials, chances are that that gene will never be expressed. It's not a death sentence. And what, a lot of women don't realize is the BRCA gene is a tumor suppressor gene, right? It's a good gene. And, even, less than 5% of breast cancers are familial and genetic. So,
right.
What's the other 95% that is driving all these breast cancers?
Lifestyle and environment, right? We can't change our genetics. Yes, we can change the expression. But if 80 to 90% of these cancers are due to the choices we're making, guess what? That puts the power back in our boat. And I'd say if someone does have a breast cancer gene, that just makes your number, your 7 essential system that much more important, right?
Absolutely. Yeah. Cutting off your breast and getting hysterectomy is not going to change your genetic code. Mm-hmm. You can still develop cancer as a result.
Yep. Agreed. Here's another myth that we have covered a little bit already, but your diet does not increase your breast cancer risk.
So when you asked that question, the first thing that came to mind was sugar. When we think of a typical chemotherapy suite, what do we see there, right? We see Cokes and donuts and candies and eat whatever you want, have ice cream, you need to put on weight. And we know that sugar feeds cancer, right? Cancer cells have, double the insulin receptor sites than healthy cells. So when it comes to cancer, when it comes to sugar, cancer cells get fed first. We know that because of a PET scan, right? Eat the sugar, or you get the IV sugar with the radiation, I forget what drug they use, but
see what lights up.
It causes you to light up, but what lights up first are the cancer cells. And so it just, shows you how important it is to avoid the sugar. So yes, what you eat matters. Make sure that you, work with a doctor who's going to be able to monitor your blood sugar. You want to keep your blood sugar and your insulin as low as possible, because if you keep it high and you're on a high carbohydrate diet, that's going to turn on, pathways like mTOR pathways that are going to stimulate cancer growth. So diet is so key.
Agreed. I want to circle back around to estrogen metabolism a bit here before we conclude. So you had alluded to various tests that are available, and I'd say one additional test that is available is a urine hormone test, where one can look not only at their hormone levels, but then look at things like a ratio called the 2:16 ratio, or look at their methylation status that you referenced. So we can see a 2:16 ratio, we can see methylation status, and we can look at a marker called 4-hydroxyestrone. And those are all predictive of poor estrogen metabolism, which can lead to things not just like breast cancer, but endometriosis or cysts and fibroids, whatnot. So that test is wonderful. I wish every woman would have that test done, because if we could start to see changes on that test, if we could see that the estrogen metabolism was unfavorable and that we could actually intervene with diet and nutrition supplements for the better, then it's my strong belief that we could be preventing a lot of these breast cancers. So I love that test, and it's a test that I run on patients with breast cancer as well. It's not just for prevention, it's from a treatment standpoint. We want to optimize all of those markers. Some you want low, some you want higher. So I think that is...
What test do you use, just out of curiosity?
So I try to use what's most affordable for the patient. So I do use a lot of the Dutch tests with Precision Analytical, but then I also use Genova Diagnostics as well. Sometimes that's cheaper for the patient. I just go with, depending on their insurance, that's who I decide. Both tests are great.
Yeah.
And DIM, that nutrient that we kind of opened our discussion with, speaking to number 1 in your system, helps influence the 2:16 ratio. B vitamins more help with methylation. Antioxidants like glutathione that you mentioned, and resveratrol and acetylcysteine, those more help lower a marker called 4-hydroxyestrone. And listening, you don't have to memorize that. You just need to find a functional medicine practitioner who can assess your labs, order them, properly interpret them, and then give you good advice on intervening nutritionally, again, to make those levels more favorable. So I want to kind of conclude with that test, but I have to ask you, you look vibrant, you look beautiful, it looks like you're thriving in life. So give us your top longevity tip.
Longevity tip? For me, I would have to say being outdoors in the sunshine and moving your body. I think that is, so important. I mean, that's why I live in Florida.
Yeah.
Grew up in Canada. I kept making my way down south. I think
more vitamin D down there. Yeah.
That's right. Sunshine, fresh air, moving your body. I think that is so important in keeping your body thriving and alive.
Agreed. So tell us where listeners can find you.
Our website is Breast Cancer Conqueror, Conqueror, Conqueror.com, and we're all over social media. And of course, we have a podcast as well, which we need to get you on our podcast. And mybreastfriend.com for very early breast cancer detection.
Wonderful. I will post a link to your website and then the Breast Friend kit and your book as well, because I think this would be a great holiday gift for a loved one.
There you go.
Investing in these things. Our greatest gift, I think, our greatest health is wealth, right? I feel like for the holidays, so many individuals are purchasing just junk for their family. We could be investing in these sort of tools and kits that actually would pay off long term, with coming back to longevity. So I love what you have to offer. So you also have a free gift for listeners. You want to share that lastly?
Yes, it's a chapter out of my second edition of my book, Heal Breast Cancer Naturally. So
thank you so much. We will get that posted as well. Well, thank you for sharing your story and how you've conquered breast cancer. I love speaking to individuals who have quite the story. Rarely do we find a practitioner or a functional medicine provider who hasn't, right? That just fuels you to share your message with the world. So thank you for what you've done. And it was an honor to have you on the show today.
Thank you so much. It's been great. You're a wonderful hostess.